listening, y'all can come join us. Y'all part of us too. This is affecting y'all. Come on out here.
Hello, everybody. Hello. My name is Darlene Gates. I've been the administrative organizer for the last 2 years, but I've been a healthcare worker for over 22 years, working here at Weinberg Campus. Today, the workers at Weinberg Campus walked out. We are participating in a statewide actions with thousands of 1199 members across the state. We are demanding that our governor, alongside with New York State Assembly and the Senate, provide the necessary investments in health care that we need in this budget.
That's right!
Our residents cannot wait. Our community cannot wait. It's time for leaders to close the deal and invest in health care now.
Now!
Fund our healthcare facilities so that places like Weinberg Campus can thrive. Weinberg is one of the last nonprofit facilities that workers here have through a struggle with the potential strike. Since then, Weinberg Campus has partnered with the union to create LPN apprenticeships and CNA programs. We are in need of this funding. It is important for us to be able to take care of these members and also to retain and recruit members to stay at Weinberg Campus so they can stay open. You know, we want to take care of the most vulnerable people, our residents. Our heart is in this. We need this funding and we need it now.
What do we want? 20%. When do we want it?
Now.
What do we want?
20%.
When do we want it?
Now.
What do we want?
20%.
When do we want it?
Now.
Kathy say cut back.
We say fight back.
Kathy say cut back.
We say fight back.
Kathy say cut back.
We say fight back. We are here today also with partners from Rochester, New York. We have here Tracy Harrison. He is also the VP of Rochester and Corning. Tracy?
Hey.
Hey, Tracy.
What do we want?
20%.
When do we want it?
Now.
All right. Good afternoon, everyone. Again, my name is Tracy Harrison. I'm the Area Vice President for 1199 SEIU, covering the Rochester Corning District. This is where we represent over 2,000 service, nursing home, and hospital workers from Rochester to Corning, Medina. Our facilities provide vital services to often facilities that are underrepresented communities, which, as we know, disproportionately affect communities of color. We're here today as healthcare workers from across the state who were once called heroes. Take action to send a message to the legislative leaders in Albany to close the Medicaid gap coverage.
That's
in
right.
this budget cycle.
What do we want?
20%.
When do we want it?
Now.
All right. More than 8 million New Yorkers rely on Medicaid for the health care coverage. Our facilities in upstate are reimbursed at a much lower rate than healthcare facilities elsewhere in the state, resulting in high turnover of staff and lower wages for workers. Our largest employer in Rochester, Strong Memorial Hospital, has lost the 340B drug pricing program as of April 1st. This is a huge loss to safety net hospitals like Strong and healthcare tenants across the state who lost $525 million in funding this month alone. Upstate facilities are reimbursed by Medicaid 24% less than facilities downstate, leaving gap in coverage that healthcare employers must make up for. Would you be okay with knowing that a hospital or nursing home tasked with caring for your loved ones is ill-equipped to provide the most basic services due to gaps in coverage? Imagine that with your mother or your father, your son or your brother. Think about it. Albany leaders must do better. Our most vulnerable, underrepresented populations by closing the Medicaid coverage gap now and investing in our hospitals and nursing homes in the budget cycle.
That's right.
Albany leaders, we call on you to increase Medicaid reimbursement rates by 10% in our hospitals now and restore $700 million in safety net funding and increase it by an additional critical safety net funding of $600 million. What do we want?
20%.
When do we want it?
Now.
And if we don't get it?
Thank you, Tracy. Now I would like to introduce, as you all know, our president and CEO, Bob Mayer.
Thank you very much. And
We're here with our partners, our direct care workers, who are the backbone of Weinberg Campus. And it's essential that we receive a significant Medicaid rate increase of 20% in order to make sure that these people are paid appropriate wages and that we can give them the benefits and wages that they deserve. Right. So in 2021, the legislators in Albany made a commitment to long-term care. They implemented regulations that require minimum staffing and require us to spend the money on direct care staff. Unfortunately, at that time, they didn't include Medicaid rate increases. We have not had a Medicaid rate increase in over 15 years. And actually during COVID, they cut our rate by 1%, which was the only state in the country that had that happen. So it's absolutely essential. We've been working on this for months. We've been meeting with assembly people and senators in Albany and elsewhere, telling them that we need this 20%. They're all in agreement that we need the 20%. But then when they came out with the One Health budgets, they only put in 10%, and the governor only put in 5%, which is not going to be enough to make sure that nursing homes in New York State are sustainable. It's absolutely terrible that seniors in New York State who deserve the best care possible aren't able to access those services because the Medicaid rates are not enough. And also, because the Medicaid rates are not enough, nursing home beds are offline, which requires the hospitals to be backed up because they can't discharge their patients. The healthcare system is broken. So we need 20%, we need it right away, and there's no excuse for not doing it. So let's get there.
And last but not least, we will hear now from our EVP, Executive Vice President. His name is Todd Hogler.
Hi. Nice to see you all. I won't keep you long because it's hailing and raining. But the honest fact is that we shouldn't even be here. It's outrageous that we have to stand here in the rain and the hail to demand that New York State take care of the people that need the care in our nursing homes and hospitals. As Bob said, there has not been a Medicaid increase, but for 1% over 15 years. We're coming off a pandemic. There's crisis in all of our institutions, hospitals, nursing homes, home care. All of you who do this work, thank you. You shouldn't have to be here fighting for what you deserve, right? Which is adequate staffing, good equipment, good circumstances to do your job providing care to the resident. So here we are at the end of April, when the budget should have been done April 1st, saying that health care ought to be a priority. It is a priority, and we're not going to stop fighting until we get 20% for nursing homes, 10% for hospitals, and we get this crisis in Western New York healthcare taken care of. So thank you all for being out here. Thank you for doing what you do. We appreciate it, and that's it.
Please say that. And two more, the people. I want you all to hear from the people that do the work. Nell Robinson and Tony Banks. Nell. Right. Well, as we know, as it was stated, Weinberg is the last not-for-profit nursing home left. I started here as the HHA and became an LPN with the help of the programs that we provided right here on the work site. 26 years later, here I am, still securing my future and providing for my family. That's what the residents need: staff longevity and continuity to get that proper care that they deserve. New York State has the lowest reimbursement rate in the country, and we haven't seen a significant increase in Medicaid rates in several years. How are we supposed to survive as a whole? As you know, the cost of care has gone up. We need to be able to continue training and have decent living wages, which cannot be accomplished without this reimbursement. You need to help provide the funding to help us stay afloat. This 20% investment is necessary.
we are walking out to call on the New York State legislators to make this happen. It should not be optional. As providers, we're doing our part. Kathy Hochul, do yours.
Hello, I'm Tony Banks. I'm a part of the EVS department here. I've been here for 13 years. First of all, I'd like to say I'm happy to work here at Weinberg Campus, as are a lot of my co-workers. Okay, we are one of the last non-for-profit agencies here left in this area. When we thought that we would close, we were kind of scared, but we made it through. We made it through COVID, we made it through hard times, we made it through working short, but we did it. We all pitched in and carried each other through this. Now we're asking for Kathy Hochul to show us that you can do what you're supposed to do. Our employers have done everything they can to recruit and retain employees here. We've created programs to train new caregivers and everything they can. Okay, to retrain. Period. We did everything we could, and train new caregivers. Now we need the state leaders to invest in health care so nursing homes like ours can continue to provide care for our communities, and our community is needed. We care for your loved ones, your grandmothers, your grandfathers, your aunties, and your uncles. Help us get this message to Kathy that we need help.
Yeah.